With hospitalizations exploding across the state, there are growing concerns about hospitals reaching their limit. WVTM 13's Chip Scarborough looks at the challenges healthcare workers face in determining that.
COVID-19 hospitalizations in Alabama are the highest they've been during the entire pandemic. More than 2,500 people across the state are in hospital beds right now, battling the virus. Projections show that number will jump to 3,500 within the next 2 weeks. So how will hospitals deal with the potential overflow of COVID patients?
Certainly, we know that our hospitals are very stressed with the numbers of patients that are there because it's really not just about physical space. I mean, they can expand physical space, but it's also about the workers that they need to take care of the patients.
Dr. Karen Lander says there's no one set plan when it comes to managing an overflow of COVID-19 patients. She says each hospital has its own emergency preparedness plan based largely on staffing availability.
The concern is always how much can you surge? And of course, hospitals are usually built in for a percent capacity increase. But I think in this particular outbreak, the demand on personnel has really been difficult when you're planning for surge.
And as hospitals continue to find ways to manage the constant increase of COVID-19 patients, does it give people a false sense of hope that hospitals can just keep caring for more and more patients?
I mean, just like any person that is committed to his or her mission in life, whether that is medicine or another field, I mean, you're going to keep stretching, you're going to keep finding a way, you're going to keep looking at contingency plans and alternatives.
But Landers points out there is only so much you can ask doctors and nurses to do. And while it's unclear what the limit is or when it will be reached, Landers worries it could be sooner rather than later. In Birmingham, Chip Scarborough, WVTM 13.